welcome to this 8th session of our Health and Climate Days. And our session today is called Adaptation Strategies, Focus on Human Health. Just in a way of framing, I'd like to say that indeed, climate crisis is also a health crisis. In the year of 2022, some 70,000 people died for climate-related causes in Europe. Those numbers are not going to be reduced, as the past 12 months, according to the Copernicus satellite observation, were recorded to have surpassed 1.5 degrees at global level. For the EU, which is heating twice the global average, this translates to some 3 degrees. And you don't need to be a rocket scientist or highly educated academic to understand that the heat stresses and other health-related challenges will increase. Luckily, this has become something that's noted at global and EU level. At COP28 in Abu Dhabi last year, climate and health were a topic of a ministerial conversation, and a ministerial declaration was adopted. We have seen anticipation, local action, and preparedness being elevated on the agenda of national and European administrators. What's also important is to note the connection to citizen. Health is something that we all care about. Climate action for health has very direct and immediate impacts on the people on the ground. And it is those people and citizens on the ground that we need to empower. And for there, we have very innovative vehicles, notably the mission innovation, the mission adaptation, and the other missions that are hosted in the Horizon research budget. By empowering, availing research, and looking at topics that are very, very pertinent in today's realities, such as soil health, such as adaptation, such as city mitigation, and health specifically on cancer, we can bring together the communities and really empower multi-level governance in a way that allows people to connect with decision-making. I'm delighted today to have people, experts from different backgrounds, but all very well-established experts in their field. Firstly, I have Andrea Schmidt, Head of Department for Climate Resilience and One Health at the Competence Center Climate and Health, Austrian National Public Health Institute. Andrea works on the interface of policy, practice, and research, currently focusing on topics such as climate resilience and health systems. So very much to the point of our conversation. I also have Dr. Sari Kovats, who is an associate professor in the Department of Public Health, Environments and Society at the London School of Hygiene and Tropical Medicine. She has contributed to national and international assessment of health impacts of climate change. So we will very much look hearing from Sari's perspective. Then we have Lukas Demuelenaere as a Clean Air and Mobility Advisor to the Brussels Minister for Energy and Environment, Alain Marron. He oversees the implementation of Brussels' low-emission city zone and its accompanying measures. We then move on to the German government level. Angelina Taylor, who leads the Office of Climate Change and Health at the Robert Koch Institute, which is Germany's national public health agency. Her work focuses again on the interface between evidence, policy, and practice. And I think it's that intersection between policy, research, and the practical implementation that we really need to focus as we move forward. I will start by asking each of our panelists to make a presentation, and then there will be a follow-up question to their presentation. After that, and during the session, you will be able to introduce Slido questions for the panelists, and during the second half of the session, we will really focus on your questions. What would you like to ask and know from the experts that we have in our panel? But with that, I would then hand over to Andrea for her initial presentation, for her perspective. Andrea.
Okay, thank you so much. It's not working yet. Okay, is it working now? Yes? Okay. Yeah, thank you so much. I'm really pleased to be here. Thank you so much also for joining this session. I know that all the other sessions are also quite exciting, so very happy that you made it here. And I will just share one slide with you. Actually, the previous one is just an idea of what the Competence Center for Climate and Health does, but I'm happy to answer these questions also afterwards in the break. Yeah, we are talking about adaptation today, and I would like to start, even though it's not yet lunchtime, with a pie. And you've seen this pie in the previous presentation by Kirsti Ebe as well. And it's the pie on the right side, and it's the pie on climate resilience that was developed by WHO. And the main message here is that climate resilience and adaptation can only take place if we involve the different areas of the health system. So from the health workforce through data and monitoring to service delivery, financing, and also the infrastructure. So this is one of the first messages I would like to come across. And I was asked to provide some insights on the policy perspective. It will be very short. Because at the Competence Center Climate and Health, while we do also research and participate in research projects, I have the privilege to work at the interface of policy, practice, and academia. And so I have three key lessons for adaptation that I would like to share now with you. The first one is, and we've heard this several times, is actually implementing health in all policies and health for all policies in practice. And it means really to build up trust with other sectors, talking to the people that are responsible for the different budgets, the different sectors in your respective countries when you want to actually implement climate resilience in your country. And I will give an example later. The second one is we tend to focus on what is not there in health data. We've heard about gaps already in the previous sessions, especially when we compare it to meteorological data. We know that heat data is, for example, much more precise than any healthcare data could ever be. So we focus on gaps, but we should actually start with what we have and consider our glass half full rather than half empty. And I will also give a short example on that. And the third key lesson is let's really involve our communities and also the municipal level. So we need to involve those concerned in implementing solutions. Also, that has been said several times. I think this applies for two parts. One, the health workforce communities. We need to bring them on board. And the second, the community champions in the municipalities that are actually trusted with implementing solutions for climate resilience and adaptation. And I promised you three examples for each of these lessons. The first one is at the Competence Center, we're currently devising a national climate resilience strategy for the health sector. And one of the things that we are doing is really to identify the people. So health in all policies means really identifying the people who are working on your topic in another sector. These might be people who are actually considering themselves to be working on disaster risk reduction or to be data scientists. They will not have heard of climate resilience of the health sector, of adaptation of the health sector for climate change. So we need to bring them on board and make them aware and build alliances with them. That's one. Then the second one is on vulnerability, capacity, and adaptation assessment. So that's a tool that was developed by the WHO for communities and municipalities, but also for member states in general. And we developed here this tool for the communities and for the municipalities to be able to assess their risk in terms of climate change, but also their capacity to respond to the climate crisis. And we did that in two parts, which is also the recommendation, a data atlas. And it's not always easy to work with the data that you have because, as I said, it has gaps. But we started with what we had, and this was quite nicely also received by the communities. And then the second, and that's important, is really to identify the community champions, the people who are motivated to work with you, who really can bring on board their own local communities. And then to develop the solutions with them that are also integrative of other challenges that they're facing. So many might be facing aging societies or people living rural areas, for example. So we need to integrate our solutions on adaptation to climate change within that. And then the final one is on climate literacy for health professionals. I said the community has to be on board, and in Austria we were lucky enough to have a Health for Future movement that was bottom up and started to work with us on this, and we're now developing a train the trainer module to really educate health professionals on what climate change means and how they can monitor, detect and treat the impact of climate change on health. So I hope I was not too long. I'm happy to answer also other questions on this in the break. Thank you.
Thanks very much, Andrea. So local empowerment and really making sure that those actors feel that they're part of the solution. And I think we all need that, because what's the prevailing notion around climate change too often is this defeatism. We can't do anything about it. So making people part of the solution will be absolutely key. Let me now move to Sari for her opening presentation from the perspective of London School, and I know your IPCC background as well, so you will have some very important insights to share.
Thanks very much, and I apologise, I'm slightly losing my voice. So I'm based at the London School, so very much coming from the academic perspective, but I have been involved in this risk assessment, so national, regional, sectoral, or even local risk assessments for climate change and health are being done now, and that is one of the prime vehicles for the translation of evidence. But again, as many speakers have said, as the health sector needs to do a much better job working across sectors, because a lot of our risks are obviously from outside the sector, to work with food, land use, urban environment, the built environment, flood risk, and things like that. So I'm going to talk about, from the perspective of some stakeholder engagement and mapping we've been doing for the NBEL project. So we talked to a lot of national and local stakeholders across Europe, but also in southern and eastern Africa. And I wanted to make 3 points about the type of evidence that these decision makers need. And so firstly, as many people have said, health is sort of missing in action, and if health in adaptation planning and implementation, and if health is missing, then equity and a lot of social vulnerability issues are also missing. So there is a need for the health sector to engage, and Andrea's just made that point very well. But also it's around capacity. So when we were talking to public health professionals, like in the UK, there's a lack of understanding about how to put health in spatial planning. A lot of adaptation is local, all impacts are local, and a lot of the local response sit firmly within local government and public health remits, but there needs to be improved capacity for public health people to look at environmental hazards, environmental management, and particularly spatial planning and engaging with the built environment, so that they can translate the health evidence, the health benefits and the health disbenefits into that health in all policies approach. And obviously breaking down silos. So where there are cross-sectoral, many countries have cross-sectoral working groups or interdepartmental working groups on climate change. The health people need to be at that table. So my second point is also about evaluation. Public health is very good at evaluation of interventions, but we need to recognise there's a direct trade-off in increasing the complexity of the interventions. So the more multi-sectoral, multi-objective interventions that we implement, the more complex they are to evaluate. It's complex to evaluate sort of healthy places or healthy place shaping interventions and built environment interventions. And we need to recognise that, which means we need to understand the type of evidence that we need in order to move and implement adaptation and the lessons learned. And that includes also the disbenefits. We heard yesterday about some of the disbenefits from nature-based solutions. If you put a lot of urban greening in, you also have to manage other risks. And equity as well is an issue here. So acceptability and feasibility. If the local community is not involved in some healthy place shaping, then it won't be successful. And finally, again, in types of evidence and standardization. So adaptation is a complex area. We talk a lot about climate resilient health systems, but we just need some understanding, whether it's through a community of practice or not, of what we understand and what we collectively agree is the minimum standard for a climate resilient health system. That may be regionally specific, and then we can move forward and assess our progress towards that goal. So I know what the direction of travel is to have more specific adaptation goals and objectives, but it's very important that health are engaged within that discussion as well. And the other type of information we need is economic information as well. So again, we need some standardization around how we do the economic valuation of these adaptation interventions. So, thank you.
Thanks so much, Sari. Extremely pertinent points. Economics, money, numbers, that's what drives decision making. And it's often very, very difficult to kind of make the evidence and the knowledge to translate into the practical applications and solutions. And I think that's where the breaking of the silos and really making sure that those people with different competencies can come together around the same table and deploy solutions that act at local, regional, and at national level. So thanks for that. Let me now move to Belgium and the Brussels perspective. Lukas, you work very close to the practical solutions. How would you kind of bring this panel into the world of your realities?
Yes, thank you. First of all, thank you for inviting me. I think this conference is really interesting. The topic is indeed urgent. I'm really happy to be here with so many interesting persons and in participating in this panel. What I thought when I was invited when I started thinking about what I could bring to this discussion is I heard so many interesting elements. Right? We heard transversality, we heard urgency, we heard about lots of scientific data, and I thought maybe what I could do is try to translate this into a local perspective. Right? How we use all these concepts at the local level in Brussels, and to bring you a local perspective. And so in this regard, I have three elements that I wanted to emphasize. So the first one, of course, is that, as you know, cities are key in tackling climate change, right? Because we emit, we are the source of lots of GHG emissions, so we have to undertake transformative actions to reduce our impact on climate change. But we are also very much impacted by the negative effects of climate change, and it also has an impact on the health of the citizens that live in Brussels. So, for example, to give you an example, in summer, the city center is 3 degrees hotter than in the suburbs. So when you have a heat wave, all the people living in the city center are much more impacted than in other parts of the country. We also know from lots of studies that this will not improve. We expect the number of days with 30 degrees or more to quadruple by the end of the century in Brussels. So there is a sense of urgency in Brussels, and this is thanks to all the studies, all the work that you are doing. So I think this is a very important point to remember. Your work is heard, at least at the local level, because we know and we hear, because we are very close to the ground, to the people. They complain, they send emails, they know it's hot, they feel it and they see it. And so we use all the data that you produce to undertake action. The second one I wanted to say is that indeed transversality is key. And in Brussels, what is interesting is that our Minister for Environment is also Minister for Health. And so he's very much aware, and I can see that he's very much aware of the interlinkages between all these worlds. And so it's very interesting because, for example, it helped us launch a study in which we studied, for example, environmental aspects, but also social aspects and also health aspects. So what we saw in this study is, for example, that where the city is very hot, you have people that are very often poorer or at least less well off. You also have lots of vulnerable people that live there. You have areas in the city that are less green than others. And so there is also an aspect of inequality that we want to tackle in Brussels. And based on that study, we are now implementing a very ambitious greening program in the city center in which we try to tackle the urban heat island effect, because we know that we are also tackling social inequality. This type of study and this type of interlinkages helped us create a political consensus, a momentum to undertake actions that are not always easy to take at the political level. So I think that this transversality is both interesting at the scientific level for you, but also for the politicians, because also you get more people aboard when you can see that it helps many different type of people, and that it helps tackle inequalities. And the last point I wanted to make is also the fact that we have so many great scientists here today and in Europe in general, but we also have to make sure that all these great models, because I was looking at the panels and all these models and all these graphs and stuff, that people understand them. Because at the political level, we also need to explain to people why we are, for example, let's say, take a parking space to plant a tree. We have to make sure that people understand that the reason why we are undertaking these transformative actions. And one good example that I could tell you is, for example, we did this very interesting citizen science project that we call Demuelenaere, in which 3,000 households, but also organizations could measure air pollution in the city. And so basically they had this very small tube, they could measure air pollution. But what I saw at my level, at the political level again, is that we then had so many people asking us, what are you doing to improve the situation? I'm breathing this, my kids are breathing that, and things like that. And also we could organize debates, because I think that in today's society we also need to discuss all these solutions. We need to create adhesion, and when people measure it themselves, they tend to be much more engaged in the solution, in wanting change. And for example, Demuelenaere, I know it is being replicated at the moment in Flanders on urban heat islands. So they are measuring heat in a park, then in the city center, then somewhere else, and they can see, oh, there is a tree, it's a bit less warm in summer and things like that. So it creates engagement with the citizens. It can also be created with noise levels. It can be created with lots of environmental indicators. So I think these are the 3 points that I wanted to highlight as an introduction to the discussion. Thank you.
Thanks, Lucas, and extremely valid points there. I think inequalities is going to be critical for us to address in pursuing our agenda. We often say that this transition, that the net zero economy can only happen if we leave no one behind. And it is indeed the most vulnerable parts of our population, those who have least possibilities to deal with the transition, but also climate impact. Their voice will be extremely important. And it's important for our actions to show that there is this possibility to really create a win-win, whereby that those vulnerables that are in the front line are taken care of. I will now move on to Angelina from the Robert Koch Institute, and she will take us a little bit back to the more high level, looking at the German national situation. Please, Angelina.
Thank you so much. We're good. Thank you so much for the invitation, and I'm really pleased to that this conference is really focusing on research on climate change and health. We all have a role to play in climate change and health. We've heard that a few times already over this conference, in our personal, private lives, as well as in our professional lives, through the institutions and the organizations that we represent. And one of these organizational groups is the National Public Health Institute. So I'd like to turn my focus to the National Public Health Institute and what role we can play in climate change and health together with other actors. So we know that climate change and health is important, and we know and needs to be addressed. And national public health institutes have a responsibility to protect and to promote the health of their populations. So it comes as no surprise that we need to focus on climate change and health as national public health institutes. We are at different stages and at fairly early stages of our work, however, in this area as national public health institutes, and of course also at varying stages of our development in this work. At the Robert Koch Institute, we've been working for a number of years on related topics, but it's really only in the last just under 2 years that we've been focusing much more intensely on our work to really coordinate the research that we carry out within the Institute, to pull together the surveillance data that we carry out, and to try and then translate that to policy and practice communities. And we established our Office for Climate Change and Health in order to really carry out that responsibility. Other national public health institutes, as I said, are at different stages of their development, and it's really important, therefore, that we, as national public health institutes, exchange between us so that we learn best practice, so that we really learn what's working elsewhere, what hasn't worked so well, and how can we work together as well. And we do this through bilaterally, but we also do this through the International Association of National Public Health Institutes, IANFI, which has a Committee for Climate Change and Public Health. And through this group, we carry out workshops. We've also developed a roadmap for the role of national public health institutes, which has really guided our work at the Robert Koch Institute in Germany to identify key priorities for how we want to go forwards in this area. So while we're at different stages of learning, some of us earlier, and we're really on this journey together, it's really as a whole network of actors that we can make it be effective as a national public health institute, and it's really through these informal and formal partnerships that we can actually make progress. That's through intersectoral working with other sectors outside that we're not actually we may not traditionally have worked with in the past as a national public health institute, say for example the environmental agencies, but also through together with our local public health departments. So thanks very much.
Thanks so very much, Angelina, and I think it's quite inspiring to hear about the way that you've kind of brought together a kind of community in itself and have really been able to capitalize on that outreach potential. And I think part of the purposes for us meeting here is to kind of inspire each other in the ways of doing things. I have seen already many very interesting questions coming in through the Slido, but I will maybe use my prerogative as the chair to ask one round of quick questions, and I ask you to be quick in responding. Let's call it a lightning round or something. And then we will go over to the audience questions, because I really do think that that's the really important interaction part where we all get something, gain something as in terms of takeaways. But let me maybe come to Lucas first. You know, there was quite some aggressive comments around the health and climate strategy. You know, the press and it's not an easiest possible operating environment in Brussels at the moment. How do you ensure that you keep the support for local action intact? And this is also something that has come from the audience, is that what are the ingredients for ensuring that you have the support for local action?
Maybe one important element to keep in mind when we look at the press and at citizens' reaction is often is to remember that the people complaining are the ones shouting the loudest, right? We know when we walk in the streets, when we discuss with people, we know that lots of people support the transition to a more resilient city, to a less noisy city, to a less polluted city, and things like that. So that's the first point that I wanted to say. The second one, of course, is that of course people are complaining, but I think that to tackle that, measuring, engaging with the people, explaining them why we are doing that is very important, and that's why I think that when you measure with them, when you go in the street with them to show them the problems, and when you listen to them, of course, you have less opposition. So that's what we try to do in Brussels.
Thanks, and I think that kind of immediacy, health is probably one of the entry points where people really tangibly and every day be it the heat wave or be it the extreme cold, the climate impacts are very, very immediate. They come too close to your skin. And I think it offers us an entry point where you're not talking about, okay, we're doing this for conservationism, we're doing this to protect the environment, but it actually has an interest, immediate interest for the well-being of ourselves. And as such, it requires really tangible action from ourselves. Let me then go back to Angelina for a minute. You recently published a report on evidence on climate change and health in Germany. Can you tell us a little bit more about that? And could you maybe relate that to one of these questions relating to the challenges for cross-departmental? Because as others have said before, we do need to break the silos. Many of the health and climate issues cannot be addressed either by the climate department or the health department. How do you work with that change resistance that sometimes comes?
Yeah, I'd be really pleased to tell you about the report that my colleagues coordinated at the Robert Koch Institute, which so it's a status report on climate change and health for Germany, and it draws on literature for Germany and also for Europe, where German literature isn't available, and it covers non-communicable diseases, communicable diseases, also the social determinants, and what's really neat about it is it also includes recommendations for action and for further research. It has a really strong communication component. So my colleagues have been working closely with health professionals in the public health community and elsewhere to really see how the findings of the report can what implications they have for policy and practice, and how they're relevant to the people in their own work. One of the things that's really, I think, special about this report is that it brings together about 100 authors representing about 30 different institutions, including from different disciplines and from different sectors. I think that's a really neat example of bringing together people with different expertise to focus on health specifically, and the editorial of the sort of editorial statement of the report brings together heads of different public agencies in Germany for whom health is relevant, who make a really clear statement and commitment to working on health and climate change. I think that's a really important symbol of this commitment to working together on such an important issue. I think one of the things perhaps that is challenging with working with different sectors and with different disciplines is actually some of the language that we use, and also how we have different narratives around around our visions. Even though, of course, we all ultimately want good health for ourselves, for our children, families, communities, and beyond. And I think that sometimes really paying attention to the language that we use, such as, and perhaps this is a bit provocative, such as health in all policies, that's very health focused. And of course, we want to come back to how health is important to us widely. But I think that sometimes that can be alienating. And I think thinking more about co-benefits can be a useful way to think about this. So I think that's perhaps one provocative thought, and I'd be interested if there are other views on this. But I think the way that we use our language in communicating with each other is important.
I think that's an extremely valid point. And as a kind of regulator sitting in the Commission, we struggle a little bit with the terminology very often. My directorate, my team works under the heading of adaptation, in German Anpassung. To me, that in itself is a very passive term. It echoes somehow resignation. What we're talking about is preparedness. We're talking about increasing resilience. We're talking about managing risks, and those risks are very omnipresent, particularly in the health sector. So terminology does matter. In particular, in times where kind of we are having a headwind towards the green agenda, regulations, etc., but we need to communicate about the immediacy, about the impact and our ability to get ahead of those impacts by increasing resilience in the different sectors, and that is, protecting the citizen as well. Now, Andrea, I'm coming back to you. As I said earlier, already at the COP28, or finally at the COP28, we had the Ministerial on Climate and Health. Before that, in Budapest, we had the WHO Ministerial, which focused on environment and health. At this conference, health ministers adopted the so-called Budapest Declaration, which talks about health and adaptation strategies. Now in your role, do you think that it is possible? Do we and do the different actors have the necessary data to come forward with these types of ambitious but necessary plans and strategies?
Maybe working.
It's working.
Yeah. Okay.
Go ahead.
Yeah. Thank you so much. Yes, indeed. In July, the Budapest Declaration was signed by WHO member states, which was a really impressive event, also for me, and a great honor to be able to be there. And in fact, one of the things that I would like to highlight here is that also, so it was said already by Francesca Racioppi also before, is that we have to build forward better after COVID-19. So that was also one of the messages. And you mentioned also preparedness and responding to acute events. But I think it's also, and that's also where the Budapest Declaration is contributing to, about the long-term perspective and really not being always kind of just responding to the next acute situation, but really building up the long-term vision. And that's where really data comes in, where researchers come in, because we need this long-term view, but also local policymakers and people with a vision that think beyond a policy cycle, like Lucas just explained. So I think it's really beautiful. And because you asked me about data availability, and I want to link it maybe to Angelina's point on health in all policies, because I feel also that sometimes we use this term a bit too often and too easily, and we don't really think about what it means. And that was also what I wanted to convey at the beginning. Really talking about health in all policies is really hard work, and we cannot think about it from only unilaterally from the health sector, but we need to bring people together, and it means going to the Ministry of Science and talking to the people there. And it's a horizontal policy integration, it's a vertical policy integration that we need to do that. And at all these levels, and that's where the data comes in, we need also the data sources, and that's where it gets usually complicated, and many researchers shy away from it. And anyway, I don't need interdisciplinary publications because my university anyway doesn't value this as much, and there is not really an incentive for an academic to publish cross-disciplinarily, like you, which you have published so many things. So really grateful for that, and I think that's where the challenge lies at the moment. So I think if we wanted to have a key recommendation on how to implement the measures that are suggested in the Budapest Declaration, in terms of data and in terms of research, it should be on the incentives on the academia side. So how are academics also incentivized to work across disciplines? But at the same time, to link it to processes such as the European Health Data Space that is trying to get health data from all the member states. But we should expand it and should be even more ambitious and think about not having just the health data available, but thinking also about how we can link it to meteorological data, to climate data, bring in other disciplines in this process, because otherwise we will end up with European Health Data Space, but again, we haven't considered the other disciplines. So I think there are a lot of opportunities there, but also a lot still to do.
Thanks for that, Andrea. And I'm tempted to follow up with a question that came up from the audience here, relating to the WHO framework on resilience. Can you maybe have some reflections or guess as to why isn't healthcare workers' adaptation to occupational climate hazards, such as heat, featured or discussed at the WHO?
Well, actually, so climate literacy is featured in the WHO framework, and service delivery is also featured there. So the main question is basically how to deliver services in the context of climate change, both acute events, but also long-term psychosocial impacts, etc. And that, of course, includes also the impact on health workers. So I wouldn't say that it's not included. It's maybe you need to look a little bit closer, but I think it's a very good point. And as I said before, like especially when you work with the communities, many are going to tell you like we don't have the capacity. And was one other question also that's there, like it's already overburdened sector. But then again, it strengthens also the relevance if you think about community nurses working or mobile care workers that will be also affected by heat substantially. So it creates also a momentum to act even more, actually. And I think, so I think we need to bring the community on board, and it's definitely there. So, but it's an important point to raise. So thank you very much.
Thanks. And of course, at European level, we have the Climate and Health Observatory, which has been developing quite good data, and it's also focusing on training health professionals to cope with heat stresses, to kind of integrate climate-relevant issues into their work and planning, also budgeting as they go along. So that type of literacy is certainly something that has become more the focus of our action. I'd go back to Sari now. You mentioned that the risk assessment. You also have been involved in the IPCC, including in the special report already 10 years ago. Now in the European climate risk assessment, health is one of those sectors that we consider to be, really very, very exposed to the negative consequences of climate change. And I already referred to the fatalities with the frequent and more intense phenomena in terms of extreme weather. We really need to get our act together and step up our game. How have you seen in the past 10 years the progress that has been made, working across sectors to understand the risk coming from climate change to health?
Well, as we've all heard, there's been sort of amazing progress, really. I mean, heat risks weren't on the agenda so much, but we've had some major events. So, never underestimate the power of an event to drive political action. But I think one of the most important advances within risk assessment framework is also adaptation assessment. So one of the kind of innovations that they've been doing in the UK is that risks are ranked. It's how to prioritize adaptation is always very difficult. But for each risk, they look at the impact and then they look at the current capacities to deal with that risk. So heat is ranked as an urgent risk, not just because of the impact on mortality, but also because there's been a lack of progress within the kind of built environment and building regs in addressing heat risks. So you can build this into your assessment so that you can understand much better. And what we haven't been doing very well is looking at past events and seeing how the health systems responded, seeing how local governments responded. And where that has been done, it's been done ad hoc, and we haven't learned those lessons. So I guess it's a small plea. Yes, we need better risk assessment. We need intersectoral risk assessment. We need interdisciplinary risk assessment. But we also need good adaptation assessments. We need, when we have the next heat wave and the next flood, we need to go back and see what worked and what didn't as well. Yeah.
Thanks for that, Sari. And there's also a question here relating to the complexity of evaluating health impact of interventions. Would you be able to come up with an example of the complexity and how you went about dealing with kind of the causalities and what's interconnected and so forth?
Oh, I should say this isn't my work, but there are some good examples, and probably people here who know better ones. So some very good actions happening at the city level. So I know in Oxford in the UK, they've implemented healthy place shaping, And that's now being evaluated, and there's interesting things going on in Barcelona as well around superblocks. So there's lots of examples, I think, of good practice, healthy urban planning that also has climate adaptation and mitigation benefits. And it's just so important that we get those evaluations and that evidence is then disseminated widely.
Okay, thanks very much for that, Sari. I will go back to Lukas now, again to the local level. I know we talked about the inequalities, the exposure of the vulnerables. One of the segments or areas that we will need to look at closer is employers like outdoor workers, but also the workers in, say, office buildings, low-paid workers that they may not have proper heating or cooling, etc. What would you see from your perspective at your level to be the kind of enablers to allow this segment, the workers or the employers, to be better incorporated into the thinking at local, regional, maybe even at national level? And I'm going to come back to also Angela on the same question.
Yes, I think that's a very good question. Actually, we know indeed that, for example, in Brussels, we have many people that are, less well paid, that work very often outside. They are very much impacted by air pollution, by heat, by all type of environmental factors, and it's indeed crucial to understand the problem. So we need data. We need to evaluate how much they are impacted. In Brussels, we have a legislation on air pollution. When we have a peak of air pollution, we know that we can public transport becomes free. You have limited work shifts. I mean, you can work on that if you know the problem, and if you know the data early enough to act, right? Because when there is a heat wave, you have to know beforehand, because at the local level, of course, you have lots of very practical steps that have to be taken, because when you make the public transport free, when you impact the private sector, you have to be sure that there is a problem, because it costs money, because it's a lot of work. So I think I would say understand the problem, then talk. And again, transversality, because environment is not, I mean, my minister is Minister for Environment. He is not the only one involved in that type of decision. So you have to discuss and things like that. So that's what I would answer. Maybe others have questions. But I see there is one question that I can contribute to about the literacy for health professional. In Brussels, what we have, so basically doctors and nurses, they have to train every year to stay up to date, right? And they get credits for the trainings that they do. And we recently included a climate change and environmental factors training in these courses, so they can choose. There is a list of 20 topics they can choose from, but at least they get some sort of recognition. And so it's not additional workload, it's included in their regular workload. So that's what I would say.
Thanks very much, and I promise to come back to Angela on the same. Maybe not limiting it just to the employers, but different. How do you allow entry from different interest groups into the policy making and into the decision making as well?
Perhaps I'll use the example of heat then. So in Germany, last year we published the heat protection plan for the first time ever, and we've now created a roadmap for this year. So it's really high. Heat is very high on the political agenda in Germany, and I think one of the really successful things with the heat protection plan is the input from different sectors, including the sector that's able to look at workers and how heat impacts on them. And we're able to complement that with at the Robert Koch Institute, so with the evidence and research, by commissioning a piece of work that looked specifically at the heat impacts on particularly vulnerable groups. And we also carry out monitoring of heat-related work-related mortality. And so with that kind of evidence and continual monitoring, we're able to really support these kinds of policies, which I think are really fundamental for providing a kind of a commitment at a national level, which then, at least in Germany, because we have a very federal system, at least then at the local level, they can translate for the employers and for employees in the workplace.
Okay, thanks very much. And I think it's good to have a very tangible example, because I think we also want to collect a repository of those types of examples that we can then replicate. And we have, together with the European Environment Agency, there's a Climate Adapt platform, and we're collecting lots of new and exciting examples that go across different sectors and professions as well. We've talked a fair bit. Go ahead.
May I add a quick comment to that? I think one of the things that I've also been thinking about over the last day or two, but also more generally, is with this example of the heat protection plan in Germany, there's a real expectation that evidence and research is ready, prepared to support policy, which I think is an understandable expectation. I think that what we need perhaps therefore from the research side is also to be really aware of when there are pressures to be able to deliver for policy and practice, to be really transparent about what that means in terms of the quality, in terms of how we're able to interpret the data, and what application it actually can have. And I think this also relates to the evaluation of complex interventions. I think we really need to be careful about and think and transparent about what evidence do we actually have, what's the quality of that, and how can it be used?
I think that's a very, very important point, because we have the most sophisticated data available from satellites, etc. But it is not just by having that data, the very complex algorithms or what have you, and models or predictions that you empower the decision makers. And that kind of capacity and access, and how do we make use of those available tools? How do we make sure that, be it the local actor, the local hospital, it's not just a cloud of numbers, but it actually translates into something that can be used in policy making. I'd like to think that, some of the platforms that we have, such as the mission adaptation, is targeted to different levels of administration to help build that capacity, the ability to make use of the tools. Going back to those capacities and what the union can do, Andrea, I'd like to come back to you. There's a big research and innovation program at EU level, and we're trying to make most use of it, including in the area of climate. And indeed, this whole 2-day seminar has been organized around that. If you had a Christmas wish, where would you see us focusing in the future in order to kind of help us taking the health and climate nexus to the next level? And in terms of what type of interventions should we support as well to make you do your work better?
Yeah, it's a tricky question, because when we started our work at the Competence Center Climate and Health 2 years ago, also around the same time that Angelina started, we also thought, let's tackle all of this at once, and let's be ambitious, and let's let's try to be quick. And we talked also yesterday in the break that there is sometimes now a sense of urgency that cannot really always be fulfilled. So I think we still need to be a little bit patient with ourselves, while still it's not an easy bridge to gap. So maybe an easy gap to bridge. So maybe other people have better ideas. But in terms of funding, I really think that each of these pieces of the cake that I showed you deserve programs, and we need to think about each of these pieces of the cake separately first, with allowing for these principles that were mentioned in our session. So allowing really for cross-disciplinary efforts. So I think it would be useful to have funding programs really asking for multidisciplinary collaborations, but even also integrating different governance levels. I think, so I think that would be definitely something. But I think we cannot tackle the topic of climate resilience from a all at once perspective. I think we need to think about each of these elements separately, because it's a completely different story if you talk about health information systems, or if you talk about how service delivery of mobile care workers should be improved in the future in the context of climate change. At the end, obviously, this all comes together, or probably even in parallel, but I think we need to give it the importance to really delve into each of the pieces of the cake separately as well. And the second point I would like to make is that I really think that we would need these, like I mentioned it before, the multidisciplinary funding would be really useful. So maybe even a funding stream from DG Klima and DG Santé together, or even DG Research. I don't know. I can make a wish list, right?
Okay, and I think it's important that now that the European elections are coming, those wish lists are coming from different audiences. We are now at the very end of our allotted time, and I will, try and capture some of the takeaways in very few sentences. I think that connecting to the local people, making sure no one gets left behind, breaking the silos, bringing the different policy communities together, all of these are elements that resonate extremely well. I myself take great comfort in this terminology issue, because that occupies me a lot. We need to talk in a language that relates to people. And health and climate, it has very immediate interface to everyday life of all of us, now and in the future. I also take the point about this not being a sprint. There's no miracle solutions that will come up overnight, but we need to build that resilience over time. We need to focus on anticipation, and also using the data in a way that is accessible and translatable, which is not always obvious. So there is a lot of work for us to do, and I do think that it's been very nice to hear from your perspectives, and gives me a lot of takeaways for our work at the Commission in DG Klima. I'd like to also mention the European Climate Risk Assessment, which is coming up in the early March. It's the first of its kind, carried out as an independent scientific report, and it looks at the sector exposure, but also policy readiness across the key policy areas, including health. So be on a lookout for that. I think it will have some very, very important information in it. In addition, the Commission will come out with a political communication, which will look at how we can best manage the risks that we have identified in this assessment. And health sector will be one of the very central areas where we will focus. So be on the lookout for those. I'll conclude here by thanking all the panelists wholeheartedly, and thanking you for the excellent questions and your active participation in the session. Thanks. Follow the script, but I think it was really good. It's so nice to have you there. Great, thanks.